Today we are going to deal one of the interesting topic, that is eating disorder. So we all have different eating habits, right? Some of them are addicted to junk food and some others have the habit of eating these plant-based food items like vegetables and fruits. So today we will see what are the conditions which includes under this eating disorder. And here first we will have a look on what is eating disorder. Eating disorder are the mental illness that cause serious disturbance in a person's everyday diet. It can manifest as eating extremely small amount of food or severely overeating. The condition may begin as just eating too little or too much, but obsession with eating and food overtakes over the life of a person, leading to severe changes. So here this eating disorder, these are the mental illness, and this illness will cause a serious disturbance, a serious changes in the person everyday diet pattern. And this can be manifested or recognized by eating extremely small amount of food, that is very less intake, or severely overeating. That is, in these conditions, eating disorder is present with overeating or eating very less amount of food. And the conditions may begin as eating too little or too much, and this will lead to the severe changes in the life of an individual. Here, an eating disorder is when a person experiences severe disturbance in eating behavior, such as extreme reduction of food intake or overeating, or feeling of intense distress or concern about the body weight or shape. So here, eating disorders occur when there is a severe disturbances or changes in our eating behavior, such as sometimes it may come as overeating, that or extreme reduction of the food intake. Why they are doing this means they concern about their body weight and the body shape. And society today promote the idols of slim bodies, and models are often taken as a role models of the success. That means today in our society there is the ideality for the promotion of these slim bodies and models, right? And they bring themselves, these models, these actors, they bring themselves to underweight to look perfect on TV and magazines. And sometimes they practice the abnormal pattern of eating behavior to look good. And in our country, India, this changes in our socio-economic and cultural activities, and also the westernization. This results in the eating disorders. Next is definition. We will see the definition. Eating disorder are psychological illness defined by abnormal eating habit that may involve either insufficient or excessive food intake to the determinant of individuals' physical and mental health. So here the eating disorders, it can be defined as these are the mental or the psychological illness, and it can be defined as abnormal eating habits that involve either insufficient intake of food or the excessive food intake that may cause the harmful or the undesirable reason to an individual person's physical and the mental health. That means this eating disorder, it can be occur as a form of overeating and the insufficient food intake, and this will cause a harmful result to the individuals or the person's physical and the mental health. Next we will see the classification of eating disorder, and the classification has done on the three major categories. In the first one, currently recognized in medical manual, that means common disorders. Next, currently not recognized in medical manual, that means these are the disorder very less common eating disorders. Next, other prevalent eating disorder, that means these are the generally accepted eating disorder. So under currently recognized medical manual, under the first classification, we have this anorexia nervosa, bulimia nervosa, binge eating disorder, and other specified eating disorder. And under the second classification, which is very less common types, in this it includes compulsive overeating, diabulimia, orthorexia nervosa, dunkorexia, and pregorexia. These are the less common types of eating disorder. And under this prevalent eating disorder, we have the classification food craving and pica. Here some of the rarely prevalent eating disorders has given, like pregorexia. Pregorexia is nothing but it refers to the desire or the idea of controlling the gaining of weight during pregnancy time by doing dieting and exercises. So pregorexia means during the pregnancy time, the mother or the woman has the idea of controlling the gaining of this weight by doing heavy exercises and the extreme dieting. Next, in the drunkorexia, there in the picture also you have seen, drunkorexia means excessive drinking habit can occurs in body anorexia nervosa and in the bulimia nervosa. So here in the anorexia nervosa, people will follow this, or people will force themselves to induce the starvation. In case of anorexia nervosa, while they are drinking more water or while they have the drinking habit, means to induce this starvation. And in case of bulimia nervosa, they just need to try to reduce their caloric intake. And in case of bulimia nervosa, they are following this drinking habit, means they will try to reduce their caloric intake. And in the orthorexia nervosa, so it is one of the condition in which the individual avoids specific food and that they believe to be harmful. Okay, they will not have some of the food that they have the belief that this particular food is harmful to them, and they will eat those food which they think is healthy for them. Okay, here in the picture also the person is holding one apple, right? So if he or she thinks that apple is good for them, they will have or they will eat the apple only, and they will refuse other food items. And in the dibulimia, so this dibulimia is an eating disorder to those patients with type 1 diabetes mellitus. So here what happen means they give or administer less dose of insulin than their usual dose, or sometimes they will not inject the insulin at all. Why they are doing this means for the purpose of weight loss. And this weight gain is one of the common side effects for the people, those who take insulin. That's why they will not take the insulin or they will not administer the insulin at all. Next, etiology. So here under the etiology, predisposing factors, precipitating factors and the perpetuating factors are there. Predisposing factors, some of the factors that can put the individual at the risk of developing the problems of this eating disorder, and it includes like biological factors, genetic, socio-cultural and the environmental. Next, under the precipitating factors, so precipitating factors means these are the specific events or the specific activities that triggers to the onset of the current problem. And precipitating factors include nutritional deficiency, life transition, family problems or family tension, then stress, media and the low self-esteem. And under the perpetuating factors, ongoing low self-esteem, ongoing stress, ongoing family tension. Perpetuating factors means these are those factors that maintain the problem, that help in maintaining the problem once it has become established. That is, this all the contributing factors like ongoing low self-esteem, ongoing stress. Okay, so these all the contributing factors which help individual for the improvement in the disease condition or the disorder. So these all the predisposing factors, precipitating factors and perpetuating factors will lead to the development of the eating disorder. Next we will see which and all include under psychological factors. Under the psychological factors, low self-esteem, that means the individuals or the person, they feels like their worth or their value is decreased. For that, they may feel shame, they may feel some hopelessness, distress and discouragement. And feeling of inadequacy or failure, here they will have insufficient or the lack of something. Then feeling out of control. So here the individual are in uncontrollable stage or the indisciplined type. Response to the changes, mainly puberty. Here during this puberty, during this time, there will be a lot of hormonal changes will occur. Okay, so due to these changes, sometimes it can be one of the factor for the development of this eating disorder. Next is response to stress, sports, dance and the personal illness. So here response to the stress, this stress will occur as a result of engaging in sports and dance. Why? Because both these sports and dance needs healthy and perfect posture, right? So this can also be one of the factor, and also the personal illness. When the person is ill or when the person is discomfort, they can't able to have the food properly. Okay, so this personal illness and the response to stress and all these are the factors which will come under psychological, and this can lead the individual to promote or to develop the eating disorder. Next is interpersonal factors. Here relationship between individuals. The first one, trouble family and the personal relationship. This eating disorder can arise from the family, can develop from the family where there is no good relationship between the family members and those personal feelings were different. And the second one, difficulty expressing emotions and the feelings. That means those who are feeling ashamed or feeling shy to express their emotions and their own feelings, that as it may be the feelings related to the likes or the dislikes of the food items. So if there is difficulty expressing of emotions and feelings, then it can be also one of the factors. Next is history of being teased or ridiculed based on the size or weight, and the history of physical or sexual abuse. When someone is being teased by others for their body weight and body size, and also those who have the history of physical abuse and the sexual abuse, these all factors can lead to the development of eating disorder. Next is social and the cultural factors. And under this, it may include like cultural pressures that glorify thinness and place values on obtaining the perfect body, narrow definitions of beauty that include only women and men of specific body weight and shapes, and also the cultural norms that value people on the basis of physical appearance. So under the social and cultural factors, it may include some of the cultural practice that done mostly for obtaining the perfect body, the perfect size, like sticking themselves only with the plant-based food items, only with the vegetables or only with the fruits. And such disorders can occur when beauty of an individual, that is either it may be man or woman, starts defining with their specific body weight and the shapes. Okay? If we think that our beauty is depend on our body weight and our body sizes, and some of the cultural norms that giving value to those physical appearance is good and not on their inner qualities and strength. And in some culture norms, in some cultural beliefs like beauty defines only to the outside appearance, not to the inner qualities and the inner strength. This and all cultural and social factors and social beliefs will lead to the development of the eating disorder. Next is biological factors. Eating disorder often run in families and the genetic components. Like research about brain and eating in taking place. Certain chemicals in the brain control hunger, appetite, and the digestion have been found unbalanced. So here, under the biological factors, these eating disorders are passed throughout our family. So learning of this coping skill and attitudes, okay, controlling of our attitude is needed. And under the genetic components, due to the presence of these unbalanced chemicals in our brain, due to the presence of unbalanced amount of chemicals in the brains, when control our hunger, appetite, and the digestion. So those chemicals which is controlling our hunger, appetite, and the digestion, when their functions or when their level becomes, when their amounts become unbalanced, that time it can also lead to the development of this eating disorder. Next is anorexia nervosa. So here in the anorexia nervosa, the first type, the term anorexia nervosa was first formulated in 1873 by Sir William Gull. The term is Greek origin, which means a lack of desire to eat. It is characterized by self-induced weight loss of at least 15% below the expected weight. Here in the first classification, that is anorexia nervosa, the first type of eating disorder, Sir William Gull formulated the term anorexia in 1873, and this word is derived from Greek word meaning a lack of desire to eat. And anorexia nervosa is characterized by weight loss, self-induced weight loss, the patient making himself or herself to lose the weight. That is below 15% of the expected weight. For example, 5 feet individual, they should have at least 45 to 55 kg, right? Then here they have mentioned like 15% below. That means they will try to maintain the weight between 28 and 30 kgs. So this will include in the anorexia nervosa, these all characters. And the signs and symptoms for anorexia nervosa are: a person with anorexia starves her or himself, or she or he can be a skinny. Here some of the signs and symptoms have given. So anorexia nervosa, these individuals, they make themselves not to have the food. That means they make suffer themselves by not having any foods. So this will lead them to the dramatic changes in their weight. Then they will sometimes have constipation or diarrhea, then electrolyte imbalances, cavities, means tooth decay, like tiny openings or hole may start or may develop in their teeth. Then cardiac arrest, amenorrhea means absence of menstruation. They will have osteoporosis, means some of the conditions in which the bones become fragile due to the deficiency of this calcium and vitamin D. And also hyponatremia means low sodium level in the blood. Hypokalemia means deficiency of this potassium level in the blood. And also brain atrophy, that means the brain has shrunk, brain size become reduced due to the loss of this neuron, and also there will be decrease in the function of the brain. Next is Chilblains, also known as Berniosis. So Chilblains is nothing but painful itching or swelling on the hands and feet. It is caused by the poor circulation in the skin when we expose to the cold. Next, there will be problem in the heart rate, bradycardia mostly, that is slow heart rate. And next is osteopenia. So it is one of the medical condition in which the protein and mineral content of the blood bone or the bone tissue, in which the mineral content of these bone tissues will be reduced. And in the leukopenia, there will be reduction in the WBC, white blood cell numbers there in the blood. Next, optic neuropathy, that means there will be a damage of the optic nerve and the individual may have loss of the vision. Lanugo, here lanugo means hair growth in the body. When the individual becomes malnourished, then hair growth will start. Why? Because the person, those who have the less intake of food items, they will have insufficient body fat. Okay, so this lanugo grows as a natural response to interrupt this body. Okay, response to interrupt this body. Next, tooth loss. Okay, the person or the individual, they may develop loss of teeth. Here, preoccupation with food recipes or cooking may cook elaborate dinners for others. So the people with anorexia nervosa, they will engage or they will try to make more recipes in this making of foods, okay, making or cooking dinner for others. There they will have more interest. Okay, they will have interest in making different recipes, in cooking different food items. They will cut the foods into tiny pieces, but they will refuse, sometimes they will refuse to eat those food items with the other family members. Sometimes they will hide the food or they will discard the food, and they will think themselves as they are overweight. Okay, even though someone's they are telling like you are very thin or you are underweight, also they will not believe. They will believe only that they are overweight. And purging means here they will use some laxative or they will use some diet pills to induce themselves for the vomiting. Okay, they will induce themselves to vomit whatever they have, and they may run to the bathroom after eating food to vomit there. Whatever they took, they will try to vomit it, and becomes intolerant to cold, means they can't able to tolerate the cold weather. Here, for the diagnostic criteria of anorexia nervosa, refusal or inability to maintain body weight over a minimum normal weight, and the intense fear of gaining weight, disturbance in perception of body shape, and also absence of menstrual cycle. We can diagnose an individual if these conditions are present. If the individual has refused to maintain the body weight, or when they are unable to maintain a normal weight, and when the individual has developed the fear of gaining this weight even though they are being underweight. Also having a misperception of their body shape and absence of this menstrual cycle, then patient or the individual may present with the condition that is anorexia nervosa. So we will discuss for today only up to the anorexia nervosa, and in the next class we will discuss regarding bulimia nervosa. So if you have any doubt, you please ask me. Thank you, students.